Hello, my name is Rebecca Alexander, and I am going to present an action plan for Baldwin, New York, which is the community that I live in. Before I get into my action plans, I want to discuss community and key findings of Baldwin, New York. The residents of Baldwin are very concerned about safety, especially when it comes to the safety of children. Around various parts of the neighborhood, there are signs alarming drivers to be aware of their surrounding areas. These signs can vary from alerting drivers and people that this is a deaf child area as pictured, and also this is an autistic child area, or a sign stating that Baldwin is a neighborhood watch community. As a resident of Baldwin, it was great to see the town renovating the streets and also filling potholes filled this past summer. After a string of car break-ins in 2011, the Neighborhood Watch community was installed at the corner of Kenneth and Marie Avenue. In addition to streets being renovated, the town of Hempstead needs to focus on repairing the sidewalks, and the sidewalks seem to be uneven on some blocks and dangerous. The residents of Baldwin are very concerned about maintaining the beauty of Baldwin, and the residents have received warnings and complaints from the town if they do not adhere to basic property maintenance, such as maintaining the lawn. There are 3 beauty supply stores within less than a mile radius of each other. These 3 businesses are all competing for the same customers. They are beauty supply stores that provide various products for beauty and grooming. Each of these businesses sells the same items for different prices, and the 3 beauty supply stores are less than a half a mile within each other, which I stated previously. Lucky Beauty Supply Store, which is photoed above the other 2 beauty supply stores, opened its doors in 1996, and it's a staple in the Baldwin community. Fox Beauty Supply Store, which is a Black-owned business that opened its doors in 2016, which is pictured in the middle, is in the same shopping center as its competitor, Lucky Beauty Supply Store. And across the street from those 2 beauty supply stores is Feel Beauty, which is also a beauty supply store that takes care of multiple women and men needs of grooming and just proper maintenance. There's a soul food restaurant in Baldwin called Benny B's. It's the only soul food restaurant in Baldwin, and it first opened its doors in 2012. This soul food restaurant is a staple in the Baldwin community, and on the inside of the restaurant, it's flooded with pictures of the late owner and chef, Benny B., and the various celebrity appearances that they have had. The owner, Benny B., passed away in August of 2020. After his passing, residents and community members rallied around his family, sending them monetary gifts while they were grieving. After his passing, I spoke to his wife, Renee, who has now taken full responsibility and runs the restaurant. This soul food restaurant is best known for their red velvet waffles and chicken, macaroni cheese, and their fisherman's platter. Renee boldly spoke to me briefly about how life and business has changed since the passing of her husband, Benny. She stated that the pandemic impacted business, but they were able to stay afloat, continuing to keep the restaurant opened after her husband's death, which was a difficult decision for her to make. Ultimately, keeping the restaurant was the best way to keep Benny's legacy alive. The 3 community health problems that I discussed in my windshield survey were poverty, drug abuse, and obesity. The first community health problem in Baldwin is poverty. In the same shopping center as the beauty supply stores, there is a Dollar Tree, and in the past year, there has been an increase in homeless population outside of the Dollar Tree. They've been asking for a change in money outside of the Dollar Tree, which is something that was not seen in the community 5 years ago. There's also been an increase of the homeless population at the Baldwin LIRR train station. There are 2 locations in Baldwin that are safe havens for the homeless population. These 2 locations are the Bethany House, which is located on Demont Avenue in Baldwin, New York, which is a nonprofit organization that houses homeless women and children. The other location that houses homeless families in Baldwin is the Huston House. The Huston House organization is a provider of emergency shelter services for families, inclusive of short-term residential and supportive services, as jointly managed and administered by the Nassau County Office of Housing and Community Development and the Nassau County Department of Social Services. There is a potential for residents of Baldwin to become obese. While performing my windshield survey, there were many people in the community that were overweight and going to eat at one of the many fast food locations in Baldwin. Within the span of a mile radius, there is a McDonald's, a KFC, a Nathan's, a Dunkin' Donuts, a Popeyes, a Checkers, a Burger King, a Wendy's, and a Chinese buffet. According to the Nassau County Health Assessment Report from 2014 to 2017, poisoning overdose is the leading cause of death for those between 18 to 35 years old, with motor vehicle accidents being second. Overdose deaths involving synthetic opioids other than methadone rose from 5,544 in 2014 to 9,580 in 2015, which is an increase of 73%. The most common drugs involved in prescription opioid overdose deaths include methadone, oxycodone, which is also known as OxyContin, and hydrocodone, which is known as Vicodin. And hydrocodone, which is known as Vicodin. These three issues are problems for the community of Baldwin because it impacts the town negatively. The main community health problem that I chose for Baldwin is obesity. Obesity is the main problem of the Baldwin community. In the span of a mile on Grand Avenue in Baldwin, there are 7 fast food restaurants. The residents of Baldwin are consuming foods high in fat and sodium. Educating the Baldwin community on the importance of consuming healthier food is paramount. For an example, Baldwin High School could benefit tremendously from my action plan. There are students from the ages of 14 to 18 that are obese and have poor eating habits. These students get to leave the school for their lunch period, and the options they are surrounded with are Checkers, Burger King, Subway, Chinese buffet, McDonald's, Wendy's, and Popeyes. Besides Subway, these food options are high in sodium and fat. These students alternate between these fast food restaurants 5 days a week for lunch. Eating processed food, fried food high in sodium will eventually cause more health problems for these students down the line. Implementing ways to educate these students on healthier options is paramount. Teaching the students at a young age to choose healthier options will be beneficial for them in the long run. My SMART goals. The first SMART goal that I have is to reduce obesity in the town of Baldwin in a year by educating the residents weekly at Baldwin Library. To achieve these goals, I will host a weekly course at the Baldwin Library, educating residents on the importance of consuming healthy food. I will educate residents on how consuming food high in fat and sodium could lead to detrimental health problems. The long-term goal for this is in the next 3 years, the class attendance will double, which means more residents from Baldwin will continue to be educated on how they can choose healthier options, which will in turn later down the line improve their health, such as their high blood pressure because they're not consuming foods high in sodium. It will also keep their BMI at a healthy level and just improve their health overall, because if they practice healthy eating now, then that is something that they can continue on in their lives, and they don't have to worry about comorbidities that come with unhealthy eating. Implementing bi-weekly classes at the library where food and nutrition is discussed. I would recruit volunteers with a background in nutrition, like a dietitian, neuropsychologist, and or personal trainer. And these classes would be a precursor to educate the residents of Baldwin to make healthier food choices. With Baldwin being flooded with fast food chains, it is important for the community to be educated on how poor food choices can negatively impact their health. From November 2021 to November 2022, within the year of educating residents twice a week for a year, we'll measure how effective the course is by having those who attend journal their relationship with food and how it's changed since taking the SMART goals and applying it to their everyday lives. Encourage the residents constantly to see if they were able to reach whatever personal weight goal they had for themselves. Have them compare their physical and lab results from the previous year to their current year physical, especially if they've been eating better and exercising. This goal is doable. Within the next 3 years, I anticipate people who have previously attended tell their neighbors and spread the information by word of mouth. The goal is worthwhile because obesity rates have steadily increased in the US over the years. And according to the CDC, the obesity prevalence increased to 42.4% in 2017 to 2018. Obesity-related conditions include heart disease, stroke, type 2 diabetes, and certain types of cancer. These are among the leading causes of preventable premature death. The estimated annual medical costs of obesity in the United States was $147 billion in 2008. Medical costs for people who have had obesity was $1,429 higher than medical costs for people with healthy weight. As stated previously, the classes will be held bi-weekly for a year following the first year, and anticipating that these educational classes will yield positive results for those who attend. After the first year, we will continue to compare our results from the second and third year to see if the classes are making a positive impact on the community. The SMART goal is to reduce the obesity in the town of Baldwin in a year by educating residents weekly, multiple times throughout the week, in educating them to choose healthier options at the Baldwin Library. The long-term goal in the next 3 years is that the class attendance of this course, healthy eating, and preventing comorbidities such as hypertension, heart disease, and diabetes, is in the next 3 years, the class attendance will double. To measure the goals effectively, the residents that come to the weekly courses will provide feedback, letting us know what they think works and what doesn't work. We will measure the vitals and see if they have had change from the beginning of the course to the end of the year when the resident has come to take their end of year vitals. This means that it gives us an opportunity to compare what the resident's health was prior to being educated and taking this course, learning about proper foods to eat, such as foods high in fiber like oat and vegetables and fruits, versus foods that are high in fried fat like the McDonald's and Wendy's that the Baldwin residents are consuming. Giving the residents a survey to fill out will give them an opportunity to detail their experience and let us know what they think works with the educational classes or what we can change to improve the outcomes for the following residents who would be educating themselves on what healthier options to eat could cause them better healthy options and just overall health. The interventions that I stated in this PowerPoint are comparing their physicals and lab results from the year prior, before they started the course, where they didn't know much about what healthy options are, where they were eating a lot of fried food and high processed food. Evaluating what their relationship with food is like a year later. So before starting this action plan, maybe they ate because they were upset and that was a way to cope with their emotions. But now after this past year, they are able to have clarity and see that is not the best way to express their emotions or express why they are upset. Community stakeholders. As a Baldwin resident, I would involve the Nassau Community Executive, Laura Curran, who is also a Baldwin resident. We would go over a budget and see if Baldwin has the funds to build a healthier food option, such as a Chipotle or any food option that serves fresh food, where it's not high processed fat food that the residents are constantly consuming 5 days a week. Having town meetings regarding the town budget and planning for healthier options for food is something that is a major economic impact for the town of Baldwin. In order to build a town that has healthier options to prevent obesity and further comorbidities down the line, we have to start from the ground up. In order to do that, we have to host several town meetings discussing what the town could afford, in this case, for restaurants or healthier options for the residents of Baldwin who are not able to choose a healthy option because they are surrounded by McDonald's, Burger King, Checkers, Subway, Popeyes, and it doesn't give them an opportunity to be able to choose something for their health. I would want the residents of Baldwin to take a survey to see the impact on the educational classes and what a healthier option would look like for Baldwin. This would mean that I would have to request funds in the budget to build healthier options for the residents. And I would also like to get feedback from the residents on what options they want built in Baldwin. Reaching out to the Nassau County Executive, Laura Curran, who is also a Baldwin resident, would be the prime idea to get things rolling for Baldwin to build healthier restaurants and healthier options for the residents of Baldwin.